October is Breast Cancer Awareness Month. Did you know Black women are more likely to die from breast cancer than white women? What can be done to improve that? Joining us to discuss this are Dr. Sonya Reid, Assistant Professor in the Division of Hematology Oncology at Vanderbilt Medical University Center, and Aleseia Saunders, a breast cancer survivor. Ladies, thank you both for being with us this afternoon. Dr. Reid, I'll also start with you. What is the current state of breast cancer rates, and why is there such a disparity in treatment and results for white and Black women?
Yes, great questions. So we know that approximately 300,000 women will be diagnosed with breast cancer this year. And while breast cancer incidence rates among Black and white women are similar, the mortality rates are very different. Black women are actually 40% more likely to die of breast cancer than white women. And there are many reasons for these racial survival disparities. And that ranges from complex socioeconomic factors to access to care disparities, as well as differences in tumor biology that all plays a role in affecting mortality rates across different racial and ethnic groups. We know that Black women are actually disproportionately affected by more aggressive breast cancers because of their biology. And we have seen that there are genomic tests out there which have come back with more high-risk hormone receptor positive breast cancer tumors among Black patients compared to white patients, which all kind of together affects the different mortality rates that we have seen over the past decades.
Yeah, and Dr. Reid, you're talking about this genomic testing. Can you talk a little bit more about what that is?
Yeah, so genomic tests are essentially tests that looks at the tumor itself. Among patients that have node-negative hormone-positive breast cancer, we're able to use that information looking at genes in that tumor to help to determine whether or not a patient has a higher risk of recurrence versus a lower risk of recurrence. And for example, a patient that have a high risk of recurrence from those genomic tests, those are the patients that will benefit from chemotherapy. And that, of course, then guides that discussion between a patient and her doctor as to whether or not chemotherapy would be the right choice as part of her treatment journey.
And Aleseia, can you just talk a little bit about your story of becoming a breast cancer survivor?
Oh, absolutely. So I was 33 years old when I was diagnosed, and actually I was pregnant with my first child and had no family history. So my oncologist had the oncotype genomic test done, which indicated that I was at a higher risk for reoccurrence. And with that knowledge, he prescribed chemotherapy as well as pregnancy termination. But I then seeked a second opinion from another breast doctor, and he utilized the genomic test called MammaPrint. And when my results came back from there, it actually said I was at less than a 10% risk of reoccurrence, no matter how large the tumor may have grew. And with that, I was able to have a different treatment schedule of no chemotherapy, as well as being able to have my daughter and then start treatment after delivery. So, during that process, I advocated for myself. I did my research, seeked a second opinion, and utilized the results of the MammaPrint genomic test to finalize my treatment plan. And when I share my story and I speak to other women or people who may be experiencing a breast cancer diagnosis, I tell them, if nothing else, make sure you advocate for yourself. Do your research, learn about the different types of treatment, the different types of genomic testing, and present those to your medical providers to see if they, are willing to do those, so you can, alongside your medical provider, determine the best treatment plan for your future.
That is absolutely good advice there, Aleseia. And really quick, I know we're out of time, but just what is your diagnosis now? How are you doing now?
I'm doing well. I'm busy. I actually have 3 children now. So I'm busy, and thanks to that, I was able to grow my family. So I'm more than thankful.
That is amazing. Congratulations to you. We wish you the best in your future. Thank you for being with us, Dr. Reid as well, and Aleseia. Thank you both for being with us and sharing this important information. I know this is something that hits a lot of women, and advocating for yourself. If you can take anything from this whole conversation, I think that right there is the key takeaway. Ladies, thank you so much for being with us this afternoon.